Hey guys, welcome back to part 2 of this series where I talk about the diagnosis and treatment of PCOS. If you've missed part 1 where I talk about the causes and symptoms of PCOS, the link will be in the top right corner. Now let's get on to it. To diagnose PCOS, a woman will need to fulfill 2 out of 3 of the following criteria, which is also known as the Rotterdam's criteria. And they are irregular menstrual periods caused by no ovulation or irregular ovulation, evidence of elevated male hormone or androgen levels, and this evidence can be based upon signs like excess hair growth, acne, or male pattern balding, or blood tests that show high androgen levels. And finally, polycystic ovaries on pelvic ultrasound. If PCOS is confirmed, blood glucose and cholesterol testing are usually performed. An oral glucose tolerance test is the best way to diagnose prediabetes or diabetes. A fasting glucose level is often normal even when prediabetes or diabetes is present. Many clinicians who treat PCOS patients also recommend testing for sleep apnea with questionnaires or overnight sleep studies in a sleep laboratory. Now, for the treatment of PCOS. Oral contraceptives, especially combined estrogen and progestin oral contraceptives, are the most commonly used for regulating menstrual periods in women with PCOS. Oral contraceptives can protect women from endometrial hyperplasia or cancer by inducing a monthly menstrual period. They are also effective for treating hirsutism and acne by suppressing ovarian androgen production. Because women with PCOS do occasionally ovulate, oral contraceptives are useful in providing protection from pregnancy. Although an oral contraceptives allow for bleeding once per month, this does not mean that the PCOS is cured. Irregular cycles generally return when the oral contraceptives is stopped. Excess hair growth on the face and other parts of the body can be removed by shaving or the use of depilatories, electrolysis, or laser therapy. In women with PCOS, hormonal treatment for excess hair growth is typically approached in a 2-step process. The first step is to prescribe an estrogen-progestin contraceptives, i.e. your birth control pill. If after 6 months of hormone treatment, sufficient improvement in excess hair growth has not been achieved, a second medication, called spironolactone, an anti-androgen, is usually added. Next, weight loss. For women with PCOS who are overweight or obese, weight loss is one of the most effective approaches for managing insulin abnormalities, irregular menstrual periods, and other symptoms of PCOS. For example, many overweight women with PCOS who lose 5 to 10% of their body weight notice that their periods became more regular. Weight loss can often be achieved with a program of diet and exercise. Another drug that is frequently used by doctors to treat PCOS is metformin. Metformin, a diabetic drug, is a medication that improves the effectiveness of insulin produced by the body, thereby reducing insulin resistance, which is one of the key factors contributing to PCOS. Not to mention, metformin has also the added benefit of weight loss, therefore is often used together with combined oral contraceptives as a mainstay of treatment in PCOS. And finally, for the treatment of infertility. The primary treatment for women who are unable to become pregnant and who have PCOS is weight loss. As mentioned before, even a modest amount of 5 to 10% of weight loss may allow the woman to begin ovulating normally. If failed, clomiphene, an FDA-approved oral medication, can be used to stimulate the ovaries to release one or more eggs. Clomiphene can trigger ovulation in approximately 80% of women with PCOS, and approximately 50% of these women will become pregnant. Letrozole, a medication that is originally approved for the treatment of breast cancer, is also found to be effective in inducing ovulation. Moreover, studies have shown that live birth rates are higher in obese women with PCOS when they are treated with letrozole rather than clomiphene. Many experts now recommend letrozole as the first choice of treatment for women with PCOS who wants to conceive. So there you have it guys, this is how doctors treat PCOS. If you are on metformin for PCOS, Do you want to know what are the 3 main side effects of metformin? Click on the link on the screen to find out more.